Good morning once again. This is Pranav Rao from Smartkarma's research team. I'm pleased to have with me this morning Dr. Karan Thakur, an experienced healthcare administrator with the Indraprastha Apollo Hospitals in New Delhi, India. Apart from being a healthcare administrator, Dr. Karan is also a public speaker, opinion writer, and policy expert on health. He specializes in hospital operations, project management, healthcare policy, public-private partnerships, human resource management, and team building. We've structured this conversation as a fireside chat, as the previous slide alluded to, and we'll be focusing on COVID-19 in India. While I have my own questions that I'll be running through, if the audience has questions for Dr. Karan, please send them through the Q&A tab at the bottom of your screen, and I'll try to work that into the conversation. It's a pleasure to have you this morning, Dr. Karan.
Thanks, Pranav. Glad to be here. Thank you, everybody, for having me here.
Great. So let's jump right into it. I think first question would get a sense for the evolution of COVID-19 in India and how you've seen it kind of change in the days and weeks.
Yes. We've all seen how COVID-19 has impacted the world, but I think this is not one pandemic. It's been different pandemics for different countries, societies, and cultures, bases a lot of their stratification, both in terms of risk and socioeconomic demographics. So in India, the challenge always was, given the wide variance that we have in the demographics, how this would impact the country and its citizens and the economy thereof. The government made some good steps initially to ensure that foreign travelers are screened and quarantined at an early stage, right about in the middle of February, which helped contain the initial surge that we saw in many other countries because of foreign international travel. There were some questions which were asked around testing, the amount of testing being done, its efficacy, and then the steps taken after that. But I think given the size and the complexity of India and the governance structure as well, where we have a union health ministry governing parts of the health paradigm, and the states being the implementing agencies and also having control over various health programs, I think there was a need for the governments at all levels to work together, which they did initially very well. Unfortunately, like in many other countries, the numbers do continue to rise, but I think that is a game of mathematics more than the disease getting any worse. But the numbers, as they have risen, the response of the government has also followed suit. So we have seen new guidelines coming out in terms of testing, newer guidelines in terms of the quarantining requirements. There's been a new app that's been introduced for contact tracing and to get your health status readily available for a government database. So those steps have been taken, and obviously the biggest has been the lockdown, which is now in its fourth avatar, in the fourth week of its implementation, just over 4 weeks in fact. And what this has done is it stemmed the number of cases from going exponentially higher given the population of India. But it remains a concern now as we reverse the lockdown and more people go out back to the community, back to work, and at some stage back to schools. So, the challenges are changing with each week and with the rising number and the profile. And the lockdown has unfortunately also resulted in a large number of people wanting to go back to their home states. These are migrants, as they're called in India, migrants who are moving for work from one state to the other, usually from resource poor parts of India to more resource rich parts of India where there is more work. And unfortunately, because of the 45-day lockdown that we've had, a lot of them are now wanting to head back to their parent states. And the fear is that that might cause a spurt in numbers, but one would have to see how that pans out. In terms of the disease itself, the strains that one has seen in China, in Italy, in Iran, some of those strains are present in India as well, at least in the initial cases, which leads one to believe that those were the strains that were brought by foreign travelers back into India. But now we are seeing more indigenous strains of the virus in India. There is about 10 of them which has been mapped already. But it is not any more virulent than the rest of the West or the other places which have been hit by it the worst. And it is not causing any higher mortality, or there is no skew in the mortality other than what we've seen in the world. So people over 65, people with comorbidities are getting the disease more severely, whereas younger populations are doing and coping with it much better.
Understood. Thanks for that. I think one thing you did touch on was the fact that the more virulent strains have come from overseas. Do you think that that is currently a risk with India kind of opening up its borders to its own citizens coming back in? Um, is there any evidence that that is leading to increased case counts?
Yes. So what one sees is that as populations migrate, both in terms of travel migration or in terms of more permanent migration, like what we are seeing now, those migrants are carrying the disease with them. And unfortunately, what is happening is that because the social distancing is not being maintained on trains and buses and other modes of transport by which people are going back, the chance of the spread is higher. But there are some strict quarantine rules of the receiving states, as they're being called. So the states that are receiving these people who are coming in, one hopes that that can contain the numbers. But again, India is, as we all know, a very large population, and the numbers may seem very alarming when you look at the digits. But given the population that we have, if we can control those, I think we can get out of this problem without too much trouble. Having said that, there are economically rich states like Maharashtra, from where a lot of migrants are now heading back to their parent states. And as we all know, Mumbai is the economic hub of India, and it is the worst hit both as the city and the state of Maharashtra, in which Mumbai is. And the fear is that the number of migrants moving back from the state of Maharashtra and Gujarat, which is another industrial state in the west of India, the more they move back, the higher the chances of the spread, because just the prevalence of disease in these two states has been the highest.
Understood. I think one thing you've already alluded to is kind of the stretched healthcare resources in the country. And again, I think the risk remains that when you've got migrants moving back to the resource-less states that they come from, the risk is that their resources there are definitely constrained in dealing with the situation. Have we heard back from any of these larger parent states effectively in terms of what they're doing for these migrants and what their strategies are to deal with the situation?
Yes. So I'll just take a step back and talk about what you just said about health infrastructure and the health system that is existent prior to the pandemic itself. The Indian healthcare system has been sort of planned and devised for communicable diseases, because that was the greatest burden that we had. So whether it's a tuberculosis or malaria or other vector-borne diseases, the health system was really attuned to take care of that. So you had hospitals and wards and surveillance programs which would look out for these diseases more than the disease that we are seeing now. The intervening 20-25 years, the 2 decades of the past of the new millennium, one has seen that there has been a move towards non-communicable diseases in terms of the risk profile for the Indian citizens. So heart disease, cancers, respiratory illnesses, those are what are afflicting people more and more. So the government went about launching a new program to take care of non-communicable diseases and stem its numbers. So we were transiting from a traditional health system which was looking at communicable diseases to a new system which is a hybrid, and then probably move towards fully looking at non-communicable diseases, because it causes 60% of mortality in India today. So in between this transition comes the pandemic, which requires a whole new approach. And frankly, the debate still rages on the best way of managing it. But for India, what that meant was that we had to quickly pivot and use the resources that have been developed both in the disease stage of our health system development and the more newer, I'm using the word newer, but it's been around for about 2.5, 3 decades, of the non-communicable shift that we've seen, the transition. The good part is that we have close to 1 million health workers, which are called ASHA workers. So these are community-based health workers which go door to door. And this was primarily done for maternal mortality, to reduce maternal mortality and infant mortality, and also encourage good behaviors to prevent non-communicable diseases. Now, today, every state has those. So the ASHA workers, uh, uh, they have been pressed into service to do more door-to-door surveillance of various endemic regions within the pandemic and within various states. That has helped. So having that infrastructure to begin with helped in terms of getting to do better surveillance and contact tracing. Having said that, this is not uniform across the country. So as you said, that some of the so-called resource poorer states do not have that infrastructure well developed as of today. So those states are those very states now receiving these migrants, and one fears that given the confluence of these two parameters, where the health infrastructure is not so well developed to begin with, and you're seeing a large influx, how will they be able to manage it? And one solution that has been offered is technology. So the app that I spoke about is being propagated so that more and more people can download it, provided you have a smartphone, which is again a challenge in India for many Indians. But that helps in better contact tracing and then isolation. But the disease, over the next 2 to 3 weeks, we'll get a clearer picture of how far and how fast it has spread. So a challenge for the policymakers today is that, look, we declared a lot of containment zones and red zones, as they were called. There was a traffic light system of risk stratification for various districts in India, and about 180 odd out of the 700 districts were declared red, which had the maximum number of cases. And these were the economic hubs of India. So, Delhi, Mumbai, and a few other places like Tamil Nadu and Gujarat, they were declared as red zone areas and districts. However, the green zones were those which are those resource poorer areas. And today we fear that while the red become green, the green should not become red. So unfortunately, that is where we are today. But there are no clear answers yet, and I think the next 2 weeks will give us some more clarity.
Understood. I kind of want to change tack a little here, and I think one area that you work in is public-private partnerships. I want to get a sense for how that has helped alleviate some of the initial concerns with COVID-19 entering India, and what kind of a role has private healthcare taken in this pandemic in India?
Yes. So if you look at public-private partnerships, it means different things to different people. It could be a partnership for provisioning. So a government could be buying from private players, whether it's pharmaceutical supplies or other means of buying, where the government is the purchaser. The other type of PPPs we've seen is where the government is the payer. So typically, I treat your patient, you pay for me, is another type of partnership that the government has entered into with the private sector in the healthcare space. Controversial one, and one which we usually all associate PPPs with, is where public land is given to private institutions or organizations to set up healthcare institutions, which has run into rough weather every now and then in each state. And then fourth is obviously research and development, whether it's pharmaceuticals, vaccine development, and other scientific research programs that are run in collaboration between government organizations and labs and the private sector. In terms of COVID-19, all of these four have shown their worth. I feel that the private sector in these four buckets have played the role of a force multiplier in the government's response. So if I take an example of Delhi, where I reside, the private sector has been roped in to provide beds and treatment facilities for COVID-19 patients. And this is not because the government did not have enough resources, but it was a felt need that at some stage there is going to be a challenge of getting non-COVID patients back to getting their healthcare needs addressed, because this is not only a COVID crisis, it may evolve into a crisis of the others. And therefore, each private hospital had designated wards for COVID-19, and they continue to treat a large number of COVID-19 patients, the bulk of which remains with the public sector, but the private sector has been roped in. Second, in terms of testing, which is the most crucial part of identifying and addressing COVID-19, is where the private sector has played a big role. In fact, 3 or 4 labs in India with a pan-India presence have been sharing a bulk of the testing load for the country, which shows that those capabilities exist, and at the right time with the right incentives, beyond financial incentives, they will step up to the plate and respond to a crisis as we have seen. In terms of research and development, the Indian Council for Medical Research, ICMR, which is the premier research body in India, which is run under the aegis of the Ministry of Health and Family Welfare, has roped in Bharat Biotech, which is a JV between a private organization and the government for vaccine development. And also it has roped in other organizations to do research on the efficacy of various drugs which have been debated quite vigorously in the international community, like hydroxychloroquine and other drugs. So the partnership has worked well. It does have some ruffles which need to always be sorted out from time to time, but I don't think one can do without the other. Having said that, there are other challenges that the private sector continues to face, where they will need to find solutions themselves. For example, the risk of COVID-19 or the potential risk of a patient having COVID-19 should not be a deterrent for a patient getting access to healthcare. And there have been instances where the private sector has been accused of not doing their part in taking in patients who may be from endemic regions or suspected of COVID-19. And those criticisms are fair, because ultimately we'll have to live with COVID-19, and this is not a defeatist statement. It's just one of scientific bearing. H5N1, H1N1 continues to be in our systems. So we will need to get COVID-19 into the milieu of healthcare offerings that we have. Why I say that is because I alluded to non-communicable diseases a little while ago, and they continue to be the biggest burden on the Indian citizenry. So if a patient of cancer does not get access to his or her chemotherapy, or a patient of cardiac illnesses don't have access to a regular checkup or follow-up, there are going to be consequences which go beyond COVID-19. And just because all our attention is on it today does not mean that we take our eye off the ball on the other challenges that we have.
Understood. Thank you. We've got a question coming from the attendees, and I'm going to read it verbatim. How have the poorer sections of India been affected compared to the more affluent people? And I think this goes back to the urban-rural divide effectively.
Yes, and that's a very good question, because what one gets to read or see is not very often, the full total picture of what is happening on the ground. So if I just break this up into a few parts, the disease, its origins, and how it came to India is widely held to be because of international travelers or expats coming back into India and having carried it. In fact, the first few cases came from the southern state of Kerala, which had expat nurses coming from the Middle East, and it is thought that that was the original source. We had a few people coming back from Italy, and they turned positive, and then it spread. So what has been sort of referred slightly cheekily in India has been that this disease was of the passport carrying category of India, and they sort of spread it to the rest of India. Be that as it may, I mean, the fact is that it did come from international travelers to begin with, and at that time it was curtailed very well with some good social isolation, quarantining, and social distancing practices that started. So the bulk of the population, the demographic, which is of the lower end of the socioeconomic scale in India, was largely left unscathed in the initial few weeks of COVID-19. But because of the lockdown, there has been a devastating economic impact on those people, because effectively these are people who are living on daily wages. So if they go to work, they earn something. If they don't go to work, but they don't take home anything. They lacked any sort of social security net, so they didn't have anything to tap onto, a bank account in many cases, or any other social security that they could tap into in this time of a lockdown. Third, many of these people reside in very congested colonies of India, virtually urban slums, for a lack of a better word. And we have seen the problem of this disease spreading very fast there because of a lack of social distancing, and maybe even some lack of education. So, for example, in Mumbai, Dharvi, which is the biggest urban slum in the world, made famous by Slumdog Millionaire. Once the disease spread there, the ability to contain it became a challenge, and we have seen those numbers balloon in that category. More than the health impact of COVID-19, the economic impact of COVID-19 for those more vulnerable sections, economically vulnerable sections, has been devastating. I won't call it a challenge, because that would be a big disrespect for them. Loss of lives has not been a challenge for them, but loss of livelihoods has been. And we need to address that. The government has taken steps in terms of direct transfer of credit and money into accounts of very many people, and they've used technology well to do so. And they made grains available, food grain available, free food available, shelters available. But ultimately, for them to come back onto their own feet, they would need those economic opportunities to come back, and for those economic opportunities to be equitable enough so that they have a chance of standing back up on their feet. As things stand today, that looks somewhere down the road and a big challenge.
Understood. We've got a question from the audience. I'm going to try to work that into my next question itself. This is around communication. I think the government has done a few things right in terms of getting people aware of COVID-19 and its risks, at least in the early parts. But it's also done certain things that are potentially not positive. And I think one of these questions stems from there. Question goes, what are your views on the effectiveness of homeopathy and Ayurveda in preventing COVID-19? And I think this was a message that came from certain parts of the administration at one point in time.
Yeah. So, and this has been part of a huge controversy that has been raging in India. There is a ministry for alternative medicines called Ayush. So the government has put a lot of effort in pricing alternative medicine. So that's something that they definitely believe in. The jury is still out on its effectiveness and the efficacy on, in preventing COVID-19. There have been some dangerous suggestions to use some of these alternative medicines as a cure also for COVID-19, but there is no proof that exists. I personally, and this is my personal opinion, and I don't need to represent anything more wider than my own opinion on this thing, that Ayurveda has its own benefits. It may be good as an adaptogen. It may be good for general prevention and better health. And when clubbed with your own body's requirements or your disease, it may be useful, as is homeopathy, I'm sure. But let's leave COVID-19, which is very well understood by scientists. It may not seem so because of a lack of a treatment or a vaccine, but the stage for experimenting is not now, because it can give us a false sense of complacency. And I think let's just follow good advice that is out there. And for people, I think keeping your immunity levels up by healthy eating, some exercise, social distancing, I think that should be our mainstay. And the government has recently launched some research work on a few Ayurvedic herbs to see their efficacy for COVID-19. But these are not human trials. Obviously, they are trials in a lab. And let's see what evidence comes out of it.
Understood. We're very close to coming up on time, and I'm still getting questions coming through. So I'm going to try to convert this into a rapid fire round effectively.
Okay, sure.
One word responses. Do you see the pandemic has reached its peak in India? Yes or no?
No.
Okay. Do you think do you see the, okay, I cannot phrase this as a yes or no question. Has India sped up its testing, and do you think it's going to meet the requirements of COVID-19?
Yes, and I'll just follow it up by, as the testing has expanded, the positivity rate has not gone up, which shows that the prevalence in the community at around 4.1, 4.2 is what it is. So even as we ramp it up, we don't foresee those positivity rates to go any higher.
Understood. Okay, last question. Is a vaccine to COVID-19 the answer to containing it?
Yes, it is eventually. But for the time being, let us not wait for that, and let us do what is in our hands and what we can do to make it possible to avoid it.
Perfect. Thank you so much.
And sorry, I have one more thing to say. Just one more quick thing to just jump in.
Sure.
Which is that I think that there's a lot of stigma that has come to be associated with COVID-19. It is a flu. For very many people, very many folks, it is going to be very severe and worse. But for a large majority of us in good health, it is not going to be anything worse than a flu. And I think that cannot be harped on enough. This is, again, not to get complacent, but just to put it in the perspective that it needs. Because it's got so much attention, because we are tracking every death as if it's a score in a sport match, it is not so. So let's put it into some perspective, reduce the stigma and the fear around it. And I think that is one way of addressing this challenge.
Perfect. Thank you again so much for your time, Dr. Karan.
Thanks,
it was
Pranav.
Enthralling conversation, and I'm sure our attendees have learned much about.
Thank you. Pleasure's been mine.